to unconscious mouth care. So I'm going to go ahead and wash hands. Knock, knock. So Meredith Gray, nice to meet you. My name is Xavier. I'll be your senior for today. I'll be helping you with mouth care, so I'll be back with my supplies. So in this particular skill, you just kind of have to tell the patient what you're going to do. We're not going to give them any options. You just have to tell them and guide them because they could be in a coma or a situation where they might not be able to respond to you. So I'll wash hands. I'll grab the supplies. Knock, knock. I'm back. So I'm going to go ahead and wash my hands. The curtains are closed, and I'm going to make sure to raise the bed up. And I can also raise the head up too, because I'm going to do mouth care, so we're going to put them in Fowler's position, 60 to 90 degrees. So Mrs. Gray, I'm just going to raise your head up so that way it's easier to do the mouth care. So it's really important as you're doing this skill that you tell them exactly what you're going to do, even in real life, because if people are in a coma, they're expecting to hear from you, they have to rely on what you have to say. So I'm going to go ahead and lower the side rail. We're going to place a Chux underneath the patient. And I have my first set of gloves. We're going to place a towel over the Chux, another towel underneath the patient's head. So Mrs. Gray, if you can, I'm going to raise your head up just to slide a towel underneath you. And then I'm going to turn your head towards me. So this is really important. Make sure the head is towards you so it's for safety. And then check the mouth for any sores, redness, white patches, anything that looks unusual to report to the nurse. We're also going to place a kidney basin underneath so there's not going to be so much mess while we do the mouth care. And you have an option. You could use the tooth-thets with the 1-to-1 ratio of mouthwash, or you could use the glycerin swabs, which I prefer. I think this is easier and it's safer for those who are in a coma. So before we start, use a padded tongue blade to keep the mouth open. So you're going to kind of slide it in their mouth, and we're going to use the first glycerin swab to clean the upper mouth and the roof. If you need to go to the other side, you need to turn the tongue blade to the other side. This goes in the garbage. I have a second one. So the second one here will be used to clean the lower mouth. So teeth and gums, use the tongue blade to turn to the other side to keep the mouth open. And then I have a third one for the cheeks and the tongue. And the last one will be for the lips. So again, we have the first one for the upper mouth and the roof, the second one for the lower mouth, the third one for the cheeks and the tongue, and the last one for the lips. Use a padded tongue blade to keep the mouth open. These all go in the garbage when you're done. We're going to go ahead and use the same set of gloves to clean up. So I'm going to remove the kidney basin. I'm going to make sure to turn their head back. So Mrs. Gray, I'm just going to turn your head back. Remove the towels. So this goes into the hamper. I'm going to raise your head up a little bit. And this goes into the trash. So I'm going to remove gloves, so pinch the palm. Put this into the garbage. I'm going to wash my hands. So Mrs. Gray, I'm going to keep your head up so that way you don't choke or aspirate on any fluids. And we're going to go ahead and raise the side rail. My last set of gloves will be to clean up. And don't forget too, when you raise the side rail, also lower the bed for safety. So lower it to the lowest position. And then my last set of gloves will be to clean up the supplies. So this is my second set. With the basin that you brought in, you can actually just put everything in there. All the stuff that was in the trash is already in the trash. And the Chux in the trash. All the personal belongings will be put away and cleaned up and put in their personal belongings. So Mrs. Gray, here's your call light and here's your phone. I'll be back to check on you in a few minutes. So I'm gonna go ahead and open the curtains, wash my hands, step outside, record and report.